What to do if someone around you is having a seizure. If you see someone who is having a seizure, stay calm. Although seizures seem to last a long time, they usually do not last more than 60 to 90 seconds. Time the seizure if you can. If the seizure lasts longer than 3 minutes, or the person seizing is pregnant, no matter how long the seizure lasts, call 911 or other emergency services immediately. A seizure can be terrifying to watch, especially if you've never seen one before. A seizure temporarily interferes with muscle control, movement, speech, vision, or awareness. It may cause a person's entire body to shake violently for a few seconds to a few minutes, and he or she may lose consciousness. Seizures can be mild to severe, and they affect people differently. Even though you may feel helpless around someone having a seizure and find it difficult to watch, there are many things that you can do to help, such as try to protect the person from injury, and keep him or her from falling if you can, or try to guide the person gently to the floor. Also try to move furniture or other objects that might injure the person during the seizure. If the person is having a seizure and is on the ground when you arrive, try to position the person on his or her side so that fluid can leak out of the mouth, but be careful not to apply too much pressure to the body. Do not force anything, including your fingers, into the person's mouth. Putting something in the person's mouth may cause injuries to him or her, such as chipped teeth or a fractured jaw. You could also get bitten. Do not try to hold down or move the person. This can cause injuries such as a dislocated shoulder. How to help after a seizure. You should check the person for injuries. If you could not turn the person onto his or her side during the seizure, do not do so when the seizure ends and the person is more relaxed. If the person is having trouble breathing, use your finger to gently clear his or her mouth of any vomit or saliva. If this does not work, call for emergency help. You should loosen tight clothing on the person's neck and waist. You should provide a safe area where the person can rest. Do not offer anything to eat or drink until the person is fully awake and alert. Stay with the person until he or she is awake and familiar with the surroundings. Most people will be sleepy or confused after a seizure. You may be able to provide feedback to the doctor while the doctor is treating the person having a seizure. Try to remember how the person's body moved, how long the seizure lasted, how the person acted before the seizure, how the person acted immediately after the seizure, and whether the person suffered any injuries from the seizure. Seizures do not always require urgent care, but you should call 911 or other emergency services immediately in the following situations. The person having a seizure stops breathing for longer than 30 seconds. After calling 911 or other emergency services, begin rescue breathing. If the seizure lasts longer than 3 minutes, the person may have entered a life-threatening state of prolonged seizure called status epilepticus. This is the person's first seizure, or if you don't know if the person has epilepsy. The person seizing is pregnant, no matter how long the seizure lasts. This could be a sign of preeclampsia. More than one seizure occurs within 24 hours. The person having a seizure does not respond normally within 1 hour after the seizure or has any of the following symptoms: reduced awareness and wakefulness or is not fully awake, confusion, nausea or vomiting, dizziness, the inability to walk or stand, a fever. A seizure occurs after the person complains of a sudden, severe headache. A seizure occurs with signs of a stroke, such as trouble speaking or understanding speech, loss of vision, and inability to move part or all of one side of the body. A seizure follows a head injury. A person with diabetes has a seizure. Low blood sugar or very high blood sugar can cause seizures in a person who has diabetes. A seizure occurs after eating poison or breathing fumes, or the person complains of severe pain after waking up or develops a fever within 24 hours of the seizure. What is the best first aid for a seizure? Always carry medical information. If an emergency happens, knowledge of your seizure disorder can help the people around you keep you safe and provide the appropriate treatment. Make sure your family, friends, and coworkers know what to do if you have a seizure. Avoid potential dangers of high places or moving machinery at home, school, or work if you have active seizures. Though there is less risk if your seizures are under control, you should focus on the specific risks of certain activities, such as mowing, working around farm machinery, hot appliances, and moving large objects. It is important for you to stay active, but you should choose your sports and other activities wisely. You may want to avoid contact sports, but if your seizures are well controlled, you can lead a normal life. The buddy system works well, so have another person with you who knows you have seizures and what to do if you have one. Activities such as baseball, bike riding, canoeing, horseback riding, or hockey can be made safer by wearing helmets and/or life jackets and by having another person with you, but this is not true for all people. If you take anticonvulsant medication, do not suddenly stop taking it or change the dosage without consulting your doctor. The type of anticonvulsant medication you are prescribed depends on the type of epilepsy you have, and the dose is determined by your weight, age, gender, and other factors. You should always be alert to the risks of possible drug interactions between your anticonvulsant drugs and other medications you may take, including over-the-counter drugs. Always call your doctor or pharmacist if you are not sure what interactions could occur before taking any medications. Most pharmacists will do this for you, and the internet has many excellent drug interaction checkers. You should avoid alcohol as it can interfere with the effectiveness of your medication and may lower the brain's seizure threshold.